Detailed information on how to use the NRDR Qualified Clinical Data Registry for participating in PQRS. So I know that a number of you may have heard or seen a good bit of background information on the QCDR, the Qualified Clinical Data Registry, and how that works with PQRS. But for the based on 2014 reporting is an additional negative 2% to the PQRS penalty of negative 2%. Next slide. So the basics of what a QCDR is, it's an entity approved by CMS that is a registry that's used for the purposes of disease tracking, patient tracking for quality improvement, and collects clinical data. QCDRs this year have shown to be typically specialty society registries like the ACR's National Radiology Data Registry. And the measures that are included in a QCDR will be reported on patients across multiple payers, not just limited to Medicare beneficiaries. And QCDRs are also allowed to report non-PQRS measures as opposed to only the PQRS measures that are in the program and reportable through other mechanisms like claims or traditional registries. And the requirements in 2014 for individual eligible professionals are shown here. I won't go into great detail, but basically for to fully meet requirements for 2014 PQRS for the incentive purposes is to report 9 measures across 3 national quality strategy domains. And if using a qualified clinical data registry, one of those must be an outcome measure. To avoid the penalty using a QCDR, you would report 3 measures on at least one NQS domain. And for both gaining the incentive and avoiding the penalty, it is reporting on 50% of all patients applicable to the measures that you're reporting. I'm just showing here the requirements for a traditional qualified registry and point out some of the differences between what a traditional qualified registry is compared to a QCDR, because it's somewhat confusing. They're both qualified registries. A traditional registry has been available for reporting PQRS measures for several years now, and an example of a traditional qualified registry is PQRSwizard, which is a product by CE City, the vendor of it. And the difference is that qualified registry, you can only report the PQRS measures. You can't report the non-PQRS measures or the registry-specific measures that, for example, that NRDR includes. The basic reporting requirements are the same as for a QCDR for both obtaining the incentive and avoiding the penalty, but the traditional registry employs the measures applicability validation process to look to see if an EP could have reported more measures than they did, if they reported less than 9. And potentially you can still receive an incentive or avoid the penalty reporting less than 9 if you use a traditional qualified registry. Whereas for a QCDR, in order to obtain incentive, you must report the 9 measures across 3 domains. Next slide. And just a little more information about the PQRSwizard product. The ACR has partnered with CE City, as have a number of other specialty societies, to offer the PQRSwizard product to members at a discount. And as I said, you can report on PQRS measures. The MAV process will be used if you report less than the 9 or measures across 3 domains. And here's the link to information on the PQRS, the ACR PQRSwizard. Next slide. So looking at some of the benefits for using the ACR's NRDR QCDR, there's a greater potential to meet the 9 measure or 3 quality strategy domain reporting requirements, mainly because there's more measures that you can select from, as opposed to PQRS-specific measures where for radiology groups there are maybe a handful of measures that you can report. Using the NRDR, we have identified 20 measures from across our registries, and as well as 15 PQRS measures. So there's many more measures that you may be able to report using the QCDR. And at the same time that you can meet PQRS participation requirements, you can also use the registries to meet maintenance of certification Part 4 requirements, and also use for quality improvement in your practice, meaningful quality improvement. And potentially, using a QCDR may better support what you're doing and your outcome under the Value Modifier program. For one reason, it's easier to monitor your scores throughout the year. You will receive at least 4 reports from the QCDR every year, as well as having access to your data online so that you can see throughout the year how you're doing and work towards improving throughout the year if that's what your numbers indicate. So with the frequent feedback and monitoring that you have of your performance scores, it does give you a greater opportunity to improve and show that improvement in your performance scores for both the PQRS and the Value Modifier program. Next slide. So the NRDR Qualified Clinical Data Registry has a selection of measures across our 5 databases: the Dose Index Registry, National Mammography Database, CT Colonography Registry, and the General Radiology Improvement Database, as well as the IV Contrast Extravasation. And at the bottom of this slide is a link to our web page on the QCDR. And just to look real quickly at the measures available, the non-PQRS measures available through the QCDR. There's a couple from the CT colonography, 6 from the mammography database, 6 from the Dose Index Registry, and 5 from GRID, and 1 from the IV Contrast Extravasation. The PQRS measures that the QCDR supports are shown here, 15 of those. The perioperative care set, the number 76 CDC insertion protocol, both of that one and the perioperative measures, many interventional radiologists may be able to report. And then the handful of diagnostic radiology measures that many of you are probably familiar with, as well as 5 of the measures from the new measures group on optimizing patient exposure to ionizing radiation. Now I'll turn it over to Maitre to walk you through some of the details of how to actually use the QCDR for reporting to CMS.
So some of you are probably already participating in the NRDR registries, and some of you are probably not. So the next steps walk you through the options for both, but it's focused on what are the special things you need to do in order to use our registries for PQRS participation. So it's a very simple checklist. You need to register your facility, which will allow you to select which databases you want to pull measures from. We need an agreement on record that allows us to collect your data. You need to enter some information about your TIN and about your physicians. And then there are a series of steps by which your physicians can access their own data, provide measures data, and monitor what goes to CMS. So the rest of the presentation will essentially walk through what it takes to get through this checklist. So first of all, if you're not in NRDR at all, you need to register your facility. And that's our website, the picture over there. It's nrdr.acr.org. When we get through the PowerPoint, I'll walk you through some of the websites. And on our website, there's a little link for a new facility registration. When you fill that form out, you receive some credentials, a username, a password, and an ID number. So it's kind of what the form looks like. It's very straightforward, just about your facility. One thing to note over here is if you are a radiology group that's interested in participating, we still need you to register each of the locations at which you practice. So if you practice at a hospital and 3 outpatient centers, we need you to register 4 times, one for each of the locations. But each time you'll tell us what your radiology group is in the radiology group data element, and that's how we keep you all together. So you'll be billed once for this whole group, but the unit that we interact with is each facility. Now, if you're already registered in NRDR, you can log in using your username, password, and facility ID. We also need a user type when you sign up. There are some functions that only facility administrators can do and others which everybody can do, and you'll see that come through as we go through this presentation. So if you are already in NRDR and let's say you're participating in the dose index registry, but in response to this new opportunity, you would like to start submitting data to the National Mammography Database or select some of the PQRS measures, you can log in and change which databases you want to participate in. So you would have the facility administrator log in because that's the only person who can add additional registries or databases for participation. And when they log in, they have this little box over here that says Registration Administration that you can click on to make any changes. Just in the past month, our web portal has changed. I think it's become a little bit more detailed and informative. So you can go through and see what databases are available to you. The sample screen that we have, the facilities are being NMD. They might be able to add some of the other databases on here. And again, the databases Judy already showed you are the 5 that we talked about. So a facility could opt to be in any or all of these databases. Once we have your registration, we do need a participation agreement on record. What this lays out is the facility's obligations for data submission and our obligations as a registry for how we protect your data. And this includes the business associates agreement because we do get patient-level information even though we don't have particularly identifiable fields. If you are already in the NRDR and have already submitted a participation agreement to us in the past, you might still need an addendum. You will only need the addendum if you want to start doing any of the PQRS measures. So if you want to submit data for any of the PQRS measures and you already have a PA on record, please do make sure to download that addendum. It's a very straightforward one-page document. All it says is, I'd like to add the PQRS measures to my PA, sign it and send it back to us. Until we have that signed document on record, we cannot accept data from you. The next step is to manage the physician group tax ID number. So when we report to CMS for your PQRS participation, we need to do that at the level of your TIN and the physician NPI. So we need to capture your physician group TIN at some place in the registry. There is a managed physician group TIN functionality that I will show you. Anybody who has access to the NRDR account at the facility level will be able to perform this function. So that includes anybody who is in as a facility administrator, a facility user, or a registry administrator. And what they need is a user type, facility ID, and password that will allow them to log into NRDR. And then so long as they have the list of data elements specified on the bottom of the screen, they can manage the physician group TIN. The important thing to note here is please be sure to give us the physician group TIN and not the facility TIN. So if you're involved with the hospital has its own TIN to bill for the facility fee, but the PQRS portion only applies to the radiology group or the physician group. So the TIN that we need over here is the physician group TIN. So you would log in using the login screen, and you would select the Manage Physician Group TIN function from the left margin. You can add and save your TINs. If your tax ID changed partway through the year, either because of some kind of change in the group or some other accounting changes, you can select the dates for which each TIN applies. So enter all the TINs that are applicable. If you are a facility with multiple locations, multiple IDs, you should be able to manage all of this information from this one screen. You can log into your master facility ID, select which child facility these TINs apply to, which registries. If you have a separate TIN for some business lines, for instance, your mammography practice has a different TIN than the other registries, that's fine. You'll be able to enter all that on the screen. The next step is to manage your physicians. Again, anybody with access to the NRDR portal, the facility administrator, user, or registry administrator, can perform this function. You log in, and you use the available tools to enroll physicians. One thing to note here is as you enroll physicians and provide us their NPIs, we have a subscription to a service that will automatically validate the NPI information. It will check the first and last name and the corresponding NPI, and if there is any discrepancy between what Medicare has on its records and what you provided, it will let you know right away. So if, for instance, your first name is Jeffrey and you've entered it as Jeff on the NRDR interface, the system will alert you when you provide the NPI to let you know that the name doesn't exactly match, so you might want to make changes to make sure the records match. So you will log in as any one of the NRDR user roles. From the left column, you will select the Manage Physicians function, and you'll complete all the required fields. You will provide your NPI and the other data fields about the physician user. At this point, we ask you a few additional questions. If you check that little button that says Enroll Physician in PQRS Measure Participation, PQRS Participation, it wants to know if this person is an ECR member and who to send the reporting invoice to. We've changed some of our screens, so when you go in and look, hopefully these are a little bit more informative. This invoice is different from what you pay for participating in the NRDR as a registry. So if you're just participating in the NRDR registries and you're not interested in PQRS, you will receive a facility level invoice and you're done. But if you want your physicians to be able to use these data for PQRS, we have an additional reporting fee. Most of you will not have to pay this year because it's waived for any facility that signed up and completed a participation agreement by July. But if you signed up after July, there will be a reporting fee invoice. And what we ask you at this point is this something that you want us to send to each physician individually, or do you want us to just send one collectively to the practice? And you have the option of selecting from those two buttons. And we ask if the physician is an ACR member or not because the reporting fee is different for members versus non-members. But if you don't select the button for PQRS participation, the invoice option and the member option are not required. You only have to fill those out if you want to use this for PQRS. You'll have to repeat steps 1 through 4 for each physician you wish to enroll. Every physician that's enrolled over here will receive an email from our system that tells them that they are now welcome to sign on and look at their physician portal. They have a special kind of user account. It's a physician user account. As a physician user, they see completely different things than what you might be used to seeing as a facility user or a facility administrator. So the physicians all have access to the physician portal. They receive their email ID. The login screen looks very similar, but once they log in, they end up in a different interface. That's what the physician portal looks like. The first thing we want people to do when we when we allow them into the portal is to review the information and to attest that they understand what their obligations are. So they have participant responsibilities. It also lists at the bottom of the screen, it automatically lists their NDI. So they need to review the screen and check off the boxes and sign at the bottom. This has to be performed at the level of each physician because we need to report the data at the level of each physician. So if you are a practice manager or the head of a radiology group, make sure that all the physicians in your practice actually go in here and attest and check and register so that as a group you can get credit for all the activities that you're doing. On this portal, the physician will be able to review all the PQRS supported measures and the non-PQRS supported measures. If your group is participating in NRDR, then all the data for the non-PQRS NRDR measures are already being collected as part of your NRDR participation. The aggregate data are presented in your registry reports. Some of these are available live. Some of these are on your static PDF feedback reports. We don't yet have the capability to show you these data on the physician portal, but we will in a few links. That functionality is still under development. For PQRS measures that you select to do, the physicians will be able to enter data for these PQRS measures through the physician portal. Only physician users have access to these PQRS data entry forms. So if you are a facility user or an administrator or a registry administrator, you cannot access these forms. You have to have the physicians log in themselves to submit these data. There are web-based data entry forms that physicians can choose, can identify which measures they want based on the high-level summary information about an exam and about the type of patient. The options vary as to what else they might be able to do. Very soon, we will also have the ability for you to upload all your PQRS data as an Excel file. Right now, we only have the web-based data entry forms, but in a week or so, you'll be able to go to the same screen, download an Excel template, populate it with values for the measures that are specific to your facility, and upload them again. All the physicians participating in the NRDR QCDR will receive feedback reports at least 4 times per year. All of these reports will contain summaries of your own data as well as comparisons to registry benchmarks. Measure data will be submitted to CMS in March following the end of the reporting year. Before we submit any data to CMS, each physician will need to review and approve the measured data. We will not submit anything until you tell us it's okay for us to submit it. And at that point, we will encourage each physician strongly to go look at their NPIs and TINs and make sure all the data are accurate so that they get attributed to the right physician. Here are some additional resources. It's our various web pages, and I'll show them to you in just a second. And then we'll come back and we'll leave the slide on. We will have a recording of this presentation and copies of the slides online. So if you feel like you didn't take notes fast enough, don't worry. You'll always be able to access these data. So this is our registry webpage, nrdr.acr.org. On top here, the first link has a lot of information about the Qualified Clinical Data Registry. It covers some of the things that Judy talked about and some of the things that I talked about. It tells you what measures are supported. And if you scroll down under core documents, there are some user guides. There is a physician portal user guide that will walk the physician through what they can do once they have their accounts. And there is a copy of some of these slides under this link, how to use NRDR for PQRS participation. It has all of these steps and phases in the checklist. So please do go look through our resources. That's the website where you log in. Like I mentioned, there is a facility user, facility ID, username, and password. You need all 4 to be able to log in. Our most common login problem is because the person who's logging in doesn't always have the user type. Make sure you select the right user type. And if you log in as a physician user, you get to see a completely different set of tools. So for those of you who've been with us for a long time, please don't be surprised if our web pages look a little different. It's just covering different functionality. As you can see, we're still in the process of adding more functions and adding more reports. So stay tuned. We'll try to provide you updates frequently so that you know what's coming. It's going to be a busy few months before we get our first reports in.
And there's also an email address for the QCDR that you can sign up for more information.
Is it on the website? There. We have a widget right here on our QCDR page that allows you to sign up for QCDR updates. So you click on that and give us your email and your name. And anytime there are any substantial changes on the website, we will reach out to you and let you know. At this point, we are open for questions. Please feel free to type them in the questions box, or if you raise your hand, we can unmute you so that you can ask them. Is there a handout somewhere that I can print out? Yes, in a couple of places. So we're going to post this webinar online. But in addition, if you go to the NRDR.acr.org page and click on the Qualified Clinical Data Registry and scroll all the way down, how to use NRDR for PQRS participation is a PDF document that looks very much like the presentation that you just saw, and it has the checklist and what you need to do. And it has some of the notes as well. The entry of individual exams does not make sense. That cannot be the methodology for reporting. It seems far too cumbersome. Can you explain? Like I said, we will be able to accept uploads of Excel spreadsheets where we have exam level data that you can just, if you have a billing system where you have these data captured or a reporting system, you can create a data extract and just upload it to our system. There are some reporting vendors that are in the process of building our functionality to auto-send some of these data to us, so you can check with your billing or reporting vendor if they can support you in that. So it doesn't have to be done as a web-based data entry form. We just offer that as an option for some of our users who may not have automated tools available.
Yes, and also at this point in the year, it might seem particularly cumbersome since you would need to go back to January to enter data, but in the future, so in 2015, to start using the tool in January and entering the data manually one exam at a time may not seem as such a burdensome of a task, particularly if a measure that you're reporting on is a low volume of patient exams.
If the OPR measures are reported as individual measures rather than a measures group, is the requirement 51% of all Medicare patients or 11 to 20 patient sample?
Well, that's a really good question. So from CMS rules, the QCDRs are not able to include and report on a measures group. So the OPEIR measures group is reportable through a traditional registry where you only have to, as a measures group, and you're only required to report on 20 patients, 11 of which must be Medicare patients. But since the QCDRs are not allowed to report a measures group, we're including them in the registry, the QCDR, as individual measures. So you would need to meet the requirements that you do for reporting individual measures, which is 50% or more of the patient cases. And since you're reporting from the QCDR, and the requirements for a QCDR are to report on all patients, not just Medicare, for reporting the individual OPIR measures from the QCDR, you would need to report on at least 50% of all your patient cases related to the measures.
What if your facility can only choose 2 of the databases? What are the options, and how do we choose the non-PQRS? 2 of the databases would be okay if you can find 9 measures, and you can combine them with some of the PQRS measures if they're available to you. Depending on which ones they are, you may be able to cover 3 domains, and 19 of our 20 measures are outcome measures, so getting the outcome measures should be fairly easy for any of the databases that you select.
And that's true, but I'm sure there are radiology groups where you, particularly for each individual in your group, where you may not be able to find 9 measures through the QCDR. There is the option in 2014 to report on 3 only, and that would you would avoid the payment adjustment that way, but would not receive the incentive. And so that's when, if that's the case where you can't find 9 measures or 3 measures, where you might want to consider using the traditional registry like PQRSwizard, or if you have been reporting claims through the year, just stick with that. And thinking about 2015, the ACR does intend to add additional measures to the QCDR, which may hit a wider range of specialty services that a group performs.
Do you want to talk about the value modifier implications for a group? So if more than half the physicians in the group can do 9 measures, but not everybody can.
Right, good point. So in carrying the requirements through from PQRS to the value modifier program, where CMS looks at performance rates from PQRS participation and assesses that at a group level. So they will aggregate all the performance scores on PQRS measures reported at a group level. So in 2 ways, either looking at a group that is registered as a GPRO under the group practice reporting option, or if your group hasn't registered as a GPRO, if 50% of the individuals in your practice have participated successfully in PQRS, then CMS will aggregate those performance rates for your group for the value modifier program. So also by statute, CMS can't allow GPROs, the group practice reporting option. Those groups cannot use, at least for now, cannot use a QCDR for meeting PQRS requirements. You would have to use a traditional registry, the GPRO web interface, or EHR submission. So to meet the value modifier standards for using a QCDR as individual EPs or eligible professionals, you would want to make sure that 50% of the radiologists in your group have reported using the QCDR.
So very similar, kind of follow-up question. If my group has 23 radiologists with varied subspecialties represented, do I need to submit 9 unique measures for each radiologist, as some measures do not apply for all RAD and or do not cover 50% of their exams read?
Yes, that's true. Each individual physician has to report 9 measures across 3 domains, one being an outcome measure, in order to receive the incentive, or for 2014 to avoid the penalty. And if so for 2014 reporting or participation, if your group, everyone, or 50% of the individuals in your group avoids the PQRS penalty, they will also avoid the value modifier penalty.
Will the data upload be on the physician portal or elsewhere? For the PQRS measures, the data upload will be on the physician portal. So you'll have to upload files for one physician NPI at a time. For the other databases, for the NRDR databases, the data upload specifications vary, and you should just look at each of the registry websites, or you can reach out to us and we can point you to the right sources online. Will you give an example of an outcome measure, please?
Can you pull up the list of, so actually all but one of the non-PQRS near-dear measures are considered outcome measures. And that's a good question because there's been, from across specialty societies, there's been a concern about the focus on outcome measures and using that as a requirement for PQRS. But the definition of an outcome measure that CMS uses is a little broader than historically the term outcome measure has been, where it's focusing on specifically morbidity or mortality. The CMS definition is looking basically at the patient's experience with the healthcare system. So it's a little broader, and CMS did vet the measures that ATR submitted for the QCDR and agreed that from our approach of the measures that they were considered to be outcome measures.
I don't see any other questions at this point. Can we check and see if there are any raised hands? I don't see any raised hands either. Go back and pull up our contact information. So at any point, please feel free to email us if you have any questions that you think of. We'd be happy to answer them. And as I mentioned earlier, we will post a version of this webinar and the slides online, so you will be able to access this information later. And thank you for attending today.
And for your interest, and we are here if you do have questions.
Oh, there is one more question just as we get ready to leave. Do we get to indicate which non-PQRS measures we'd like to report per physician? Absolutely. Every physician gets to select which measures to report, and if they have more than 9 measures available to them based on all the registries that they are in, they can pick and choose and select their best 9 for reporting. So you can definitely select which ones you want for each physician. So I think that was our last question. So thank you again.
Thank you for attending.
Bye.